Hello everybody, welcome back to the Norries podcast. Before we get into it there, we just want to remind people that we're supported through Danny Donovan at quickminutes.com.
Yeah, Danny's a very good friend of both myself and James. He comes from the north side as well, and he grew up locally, and he's been a massive supporter of the podcast and both myself and James since we actually began. And he has his own company called Quick Minutes now, and
quickminutes.com is a meeting management application for semi-formal and formal meetings. And look, if you want to know more about that, quickminutes.com, and supporting Danny's supporting us. So if you're interested in that, check them out and enjoy the rest of the podcast. Hello everybody and welcome back to the Norries podcast. I'm your host James, and I'm joined as always by my good friend Timmy Long.
Hi everyone.
Sean is on the switcher. How are you, Sean?
Not too bad, how are you?
I'm not too bad, boy. Martin Davoren, the Chief Executive or the Executive Director of the Sexual Health Centre, is our guest today. How are you, Martin?
I'm good, thanks, lads. How are you?
Very well. Thanks for joining us.
I'm delighted to be
No,
here.
you've been a guest. You've been somebody that has been recommended a lot. Particularly by one man, Donald.
Yeah.
Donald.
He speaks very highly of Donald Clifford.
Oh yeah.
He speaks very highly of you and your work and what you do. And before we do get into the podcast and you start explaining a few things to us, let us know who you are and where you came from, so where you grew up, and you told us beforehand you were a Clareman, so how you even made it down here to Cork. So if you want to begin at the start.
Yeah, so I grew up in North Clare, close to Ballyvaughan, so almost on the Galway border. And was looking around for things to do in college and what would I do when I came to Leaving Cert. And public health and health promotion was in UCC at the time, and it was the only course in Ireland that had public health and health promotion. We'd come to Cork on holidays, but I knew nothing about Cork. But anyway, off I went, applied and started. Loved my time in UCC, it was great, and public health was a really good fit for me actually. It was a really small class. It was like going from secondary school again, because there was only 24 of us in the year. And the school that I joined were really supportive, just a really nice environment to be in. And I always wanted to work in something to do with healthcare, but I couldn't be in a front line like doctor or nurse. Like the idea of that, just way too stressful and I think very challenging. So public health was a lovely mix where you are involved in healthcare and could be involved in policy or change or improving someone's life without having to learn how to take blood from a patient. So I did that, and then the opportunity came to do a master's afterwards, so I kept going. Always said I wouldn't, but did.
What you do your master's on?
It was in public health as well, actually. I wasn't moving too far from that school. I settled in, and that was it. So my master's then was was specialising more in health promotion area. And during the master's, an opportunity came up to apply for a PhD. So I kind of never saw it coming, but it was a really good fit. The PhD was on alcohol use among the university student population in Ireland. And it was kind of co-funded by UCC. They were looking to do something. And it was I applied and got it, and it was a brilliant opportunity for me. It was great to...
That must have been an interesting topic.
Yeah. I'm interested to hear more about that. What were your findings, or what were the key findings to stand out?
So I did this, what was called mixed method study. So it was like qualitative interviews where you spoke with students about their experience of what it was like to be living in college and transition into a university sector, maybe move away from home and start their lives with their peers. And then we did a big survey of university students as well. So I had over 2,000 responses to that. The biggest findings in that were that actually years ago it used to be the fact that maybe male students were drinking to a more hazardous level than female students. But at that point in time, which is around 2015, the levels had changed. So it was around 2/3 at that point in time, but both male and females were reporting hazardous alcohol consumption for about 2/3 of the population. And the interviews then were really interesting. So I tried to create my PhD was focused on creating typologies of drinkers. So like, what type of person are you, and what's your relationship with alcohol and your relationship with your social life? So the interviews were great because people were really open and honest about their experience. Like why they started drinking or why alcohol had become such an important aspect of their university experience, and how they got involved in it. And people spoke about the need to make new friends and try to find a friend group when they got to college, and how they had the secondary school crew, but they joined a new course, or they'd moved away from home and they didn't know anyone, and socializing was the only opportunity they had. So it was brilliant, and the PhD was also great because I suppose the university had half invested in it, and were trying to make changes around that. So that led to the development of REACT then, which was responding to excessive alcohol consumption in third level, and that was a health promotion initiative, kind of looking at the setting of the university. So how can we create more social spaces that aren't alcohol focused for people who are attending third level, or how can we provide more environments, support services, policies that aren't, that not every university event has alcohol at it, or things like that.
There seems to be always a problem with alcohol consumption up around college roads with the students and stuff, and even during my own time out in MTU and having some of the students, the younger students in my class, I was thinking to myself, because I'm an alcoholic myself, and I said, a lot of these kids are from the countryside, and it's their first time without their mothers and fathers telling them what to do and what time to be home, and it's like they're just after being left out of the cage, and they're out and they're enjoying themselves, and a lot of them probably never drank before, and they probably lack self-esteem and confidence, and now all of a sudden they're in college, right? They're drinking, which is giving them confidence, and their self-esteem is getting better, and they don't have to be home at a certain time. They can stay out all night if they like. I think it's fantastic. Like that would be one of my main understandings of why alcohol consumption within the college third level education is so high. Because of that. And that was my understanding of it. Would you agree?
Oh, totally. Like that point in time, people talk about it as emerging adulthood. You're trying to find your peer group. You're trying to set yourself up as an adult. You've moved out of home where maybe all your decisions were taken away from you in a way, and you just went along with whatever. And you have this immense amount of freedom. As myself, like it was a great time where you're learning about yourself, and you have a whole new life that's opened up to you, and there's a great excitement to that, but there's a challenge to it as well, and some people find it very challenging, I think, to navigate that for themselves effectively.
Yeah, and you made a good point as well about the young people coming up from rural or country areas coming into the city. And I remember Cameron Blair was tragically murdered over by Sharman Crawford Street there. But you have young fellas not from the city coming up to the city, and then if they're shared accommodation, there might be parties, but then they cross paths with fellas from the city, and they're different cultures, and the city isn't as safe as Clonakilty or some of the rural areas, you know what I mean? And stuff that might have gotten resolved kind of amicably maybe in the country, there'll be weapons used in the city, and young fellas from very deprived backgrounds, or not making excuses for anybody now, but young fellas can be a bit more wilder, and they mightn't be a part of the college, but because where the college are situated, there's going to be a lot of footfall, and sometimes the point I'm trying to make is young fellas not from the city, you have to be careful when you're in the city drinking, because it's not as safe as drinking back in your rural town, and you are more likely to bump into young fellas that might be carrying weapons, and just to walk away. If you have an opportunity to walk away from a fight, walk away, or if you're going to be drinking, don't drink, keep yourself safe,
Yeah, it's a different environment, like, isn't it?
Absolutely. What about sex, and like when you were doing that study, did anything come up about sex and maybe sexual assaults or sexual misconduct while people are under the influence? Was any talk about that?
So mine didn't focus on sexual assaults, but there's a good bit of research that points to that. But what mine did focus on was people's the association between maybe unprotected or unintended sexual encounters after alcohol use. So people's inhibitions are lowered,
kind of goes out the window, it really does.
Yeah. And so at that point in time, people were reporting high levels of unintended or unprotected sexual encounters, and maybe making decisions that they may not have made if they weren't under the influence of alcohol.
Was it a touchy subject for a lot of the students doing the interviews? Like in terms of touchy, what I mean is, was there a lot of shame associated with that subject with them, that they didn't want to really admit that they're meeting people on one night stands and having sex with people unprotected and stuff like that? Did that happen or?
I suppose it didn't. Like everything, there's a bit of everyone you meet, when you do these interviews. So for some people, there may have been, and for others, people were very open. I suppose with the interviews, people got to kind of opt in. So if it was something that they were interested in getting involved in, or they wanted to speak more about, they could. And it was the great thing about being part of ECC. There was good support structures available. So their student health service is excellent, and was a referral pathway for anybody where something did come up for them, and they were worried. Or there's UC counselling services there as well. There's peer support services across UCC. So they had done, I suppose there was an awful lot of supports available before I went and spoke to anybody, and they were all signposted to them afterwards. So that was available for people.
Okay. So, let's dive right in.
Yeah.
So, in your eyes, what way is the state of sexual health scene in Ireland at the moment?
Yeah, so sexual health really is a kind of an ever-changing, evolving landscape of our society, isn't it? It's an intimate part of a person's life, so it's not too often spoken about, and that's why it's great to be here, to give it a platform.
We always talk about the awkward stuff here.
Yeah, it's great. It's great. And I think for sexual health, because it's an intimate part of a person's life, people always try and move it away from their own experience. So people like to move it into a young people's issue or an older person's issue. They don't want to name it for their own population or maybe age cohort. But sexual health has really improved, I think, and the services associated with sexual health have transformed over the years. So the organisation I work for, which is a sexual health centre, and we're just behind the Mercy Hospital, opened its doors originally as Cork AIDS Alliance in 1980s. So it was in 1987 it opened, and that was at the height of the epidemic in relation to HIV. And at that point in time, it was a therapeutic organisation and supporting people as they were diagnosed and giving them care in a house that was actually based out near Wilton at the point in time. But I suppose the needs for sexual health then changed. So in the 90s, the organisation changed its name and became the Sexual Health Centre and broadened its remit to support people in a variety of ways. I think with sexual health, people often go to sexual health equals a sexually transmitted infection. That's what they think of straight away. But it's not. It's much broader than that. Like, sexual health can be anything from your relationship and having a healthy relationship with yourself and with others. Includes consent, includes your sexuality, your gender identity. It can be about your pregnancy journey. It can be about your experience in intimate relationships and how that's working for you or not working for you at that point in time.
Even knowledge around your partner. Do you know?
Yeah.
We spoke with Grace O'Shea, who's an occupational therapist specialising in sex, and she was speaking about not all women are the same, and sometimes you need to use lubricant, you know, but men can be a bit ignorant to stuff like this, you know what I mean? And you think if you're after having a sexual intercourse with one woman, it's going to be the same with the next woman, but sexual health encompasses the educational piece as well.
And having the communication around that as well. So having a kind of open channels of communication between you and your partner, because everyone has their own likes and dislikes and their own needs. So it's not a one-size-fits-all approach. Do
you think a lot of men's likes today are in relation to what they're watching on porn?
Yeah, so pornography is one of the biggest issues, I think, facing us internationally. Like, the Centre for Disease Control came out a few years ago and said that porn was one of the emerging epidemics worldwide. It's the most Googled thing every single day. And one recently, now how recent, but a few years ago, the Health Behaviour in School Children report noted that most young people were getting their education in relation to sexual health via pornography.
And that is it, tell me, is it healthy or unhealthy or in between?
No, sure. Pornography is it's an act. Yeah. So they're actors paid to do a role. There's a script. There's a way it's supposed to work. It can't be true.
Editing done and
it can't be true for real life. You know, like it's totally different.
And even the way some of the men treat the women on camera, and some of the sex that they perform is
degrading acts.
It is. It's not love. It's not two adults consenting to a certain way of having sex. It's degrading for the woman.
Yeah.
Straight away.
And if you're a young girl and you don't have the wisdom to know, this, you will feel that maybe you are supposed to be submissive. Maybe you are supposed to just take this rough or take this, in this way, and maybe it is meant to be a cold experience, and you're just objectified, and that's a sad kind of reality for some women, some girls, that's how they're having their sexual encounters at that age. Do you get girls coming to your centre that had kind of sexual experiences like that at a young age and traumatised from it?
So I suppose for our organisation, we've a number of different arms. One of them would be our health promotion arm. So we've a number of health promotion officers that go out and meet people in an outreach capacity. So one of those would be our young people's health promotion officer, who goes out to youth reaches or individuals in non-formal education settings. So sometimes they haven't received any RSE. There's never been relationship and sexuality education.
That's with the ETB, isn't it?
With the ETB,
I was at the ETB that time when Roe Griffin was and Mick Finn was.
Oh yeah, they're great.
They're a nice team, aren't they?
Lovely team, and really supportive of us. They've been brilliant. And that's a really important program. It's a 3-week workshop, and it goes through everything from pornography to healthy relationships to communication and how you communicate with your partner, consent, sexually transmitted infections, and what support services are available. Sometimes people might have a worry or a concern, but they don't know where to signpost themselves to. And so that program, at least at the end of it, the young people are furnished with, right, if I may not need this service today, but in 2 years' time, 5 years' time, 10 years' time, if I do, I know where I can look and
you're
where I find
the
support
seed, aren't you?
Yeah.
For that might bear fruit down the line. And so that's the young people. And the other spectrum then, right? I visited a community health project. I won't say where, just for the, protect the people that attended the group. But the group was for older women.
Oh, yeah.
And it was around sexual health for older women. And I was told that there was a lot of older women in the area presenting with STIs that for the first time probably in their lives, there's no husband. The husband might have passed away, or they might be might be bereaved, or they might be divorced. The kids have grown up and they're sexually active now, maybe for the first time since they were very young, but they don't have any awareness around the dangers of it, or they might think that STIs is for younger people. And there was more and more women and men older presenting with issues related to lack of education. Did you ever come across anything like that?
Yeah, so if you think for older people, what the sexual health education was like for them when they were growing up was virtually non-existent. Like
that priest in Kerry.
Oh yeah,
Father Sheehy.
Yeah,
it was bad out, like.
Yeah,
you know what I mean?
Like it was like, and that was the way it had to be. There was rules around how life was supposed to work and how society was supposed to be. And for loads of those people, they would have never, sex was never spoken about, and never spoken about in a positive way. If it was to come up, it was that people just weren't supposed to speak about it at all. So we do, we've another health promotion program that looks at outreach support for other marginalised groups. So people who are engaged in probation services, people who are engaged in injecting drug use, from individuals from migrant communities. Individuals who are gay, bisexual, or men who have sex with men, and people who maybe didn't get the sexual health education that they needed at any point in time. So even like for that example you gave there, James, of like somebody who's starting a new relationship later in life, who may not be aware of the risks, the supports, the services, even for STI screening services, where they would go should they have a query or if they want to ask a question. So oftentimes, it's really important to give them that information as well and signpost them to where they want. And often people just want a signpost, so there's an education piece where you're building their capacity to provide them with the information they need, be it in relation to relationships or in relation to STIs or in relation to consent or whatever it might be. And then sometimes people just need the in bit, which is like, I don't need you now, but I know where to go. And I can signpost myself into that service should I need it.
I was thinking then, like at that age, that we put out the pasture, but fair play to them, if they're keeping active and all that. But you kind of hit the news there recently with the father she comments below. I think I tagged you on Twitter. Did you see them, Timmy?
No.
Timmy don't be on social media, but this thing went viral 2 weeks ago. So this priest gave a sermon in Listowel in mass, but he spoke terrible about gay people, LGBT people, and he gave this one story then about how this woman said to him that his daughter was in Tralee during the weekend and she got a condom off somebody working from the HSE out of a bus, and like they're out there promoting promiscuity and sex, and he was saying that it was a terrible thing. But I was there, I know who that bus was. That was your bus, wasn't it?
Yeah, it was our bus. I'd say, I can't be sure, but I'm sure it was Dash. Yeah.
Tell us about the bus.
Yeah, but we're really proud of the bus and delighted. We're very lucky to have received funding from HSE in CH04 to deliver the bus in collaboration with Cork Local Drug and Alcohol Task Force and the Southern Regional Drug and Alcohol Task Force. So DASH stands for Drugs, Alcohol and Sexual Health. Because people don't take a risk in a silo. Like you don't, like we were talking about earlier with unintended and unexpected maybe sexual encounters after alcohol. That's what happens. Risk comes in multiple areas. And so providing support for one and not providing support for the other is sometimes counterintuitive.
Because if you're somebody in especially somebody in addiction, they've no regard for their health. No. And that includes the sexual side of it. Like if they're not going to the doctor to dress a wound on their arm, they're definitely not putting on a condom. So like it's great to have that initiative.
Yeah, it's great. So we launched in 2021, and it's been busy since. So it's a mobile health unit. It's a van, and it's going across Cork and Kerry. So oftentimes one of the issues with support services is, and we are there, and many are doing great work, but are limited by the fact that of their location. Like us, we're in the centre of town, and we expected people pre-COVID to come to us. It was like wherever you are across Cork County, you have to find yourself at 16 Peter Street if you want a service. Dash changes that because it puts all of our services into the back of a van and transports us down to Bantry or off to Killarney into Tralee. And so we can meet people where they're at and provide a service for them in their local town. So there's been loads of learning with it, but it's been really good. So
that service, does that come with the bus? Does it come with some form of a counsellor or somebody that a lot of people could talk about sexual health issues to whoever's on the bus? So the way it's worked so far is we usually work with community groups in different areas. So there might be a family resource centre, or there might be a community organisation that's working in a local town, and we'll use their car park to park up. We'll have a health promotion stand as part of the outreach. So that'll include everything from information around Cool Mine and drug and alcohol workers. If anyone has any questions, that they can link themselves back to that. That's a great service.
Yeah,
it's brilliant.
If there's a community group now in some part of Cork and Kerry at the moment, and they want to book you, can they actually do that? Can they ring up and say, look, we have a group here, do you mind coming down to us?
100%. Katrina would only be delighted to hear from them. So it's dash@sexualhealthcentre.com and email away. Where the bus, we always think of it's a mobile health unit for the community, so once it's in use and it's out and about and people are engaging with it, it's brilliant for us.
It's a fantastic idea. What it reminds me of is the bus the City Library used to have years ago, and they'd go to all the rural towns and they'd have people come on and they'd get their few books until the week next.
What am I laughing about now? Do you remember the Good News Caravan?
I do. There was what were they?
The Good News Caravan, they were born again Christians, I never know, because they used to get some abuse, but it was the Good News Caravan used to drive around the north side anyway, definitely. I don't know about anywhere else, but it used to come up to Knocknaheeny and Harry Hill. But it was born again Christians, but it was like a mobile sermon, and they'd pull into the estate and they'd do a mass in the back of the van. But they used to get battered with rocks and eggs.
But you know what? It used to be packed as well, because they used to give the kids sweets and they'd feed you, like, and they give you, you know, so, like, back then a lot of the kids were starving.
Yeah.
So, like, they'd be in here, like, it was like years ago when the English started feeding the Irish people during the famine, and they had to change their names. You know, it was like these people knew if you feed the Irish, they will come.
I know, yeah.
You know.
But they used to get some abuse, wasn't they?
They did. Oh, Jesus Christ, they got tortured, like, and they didn't come back anymore after a certain amount of time, because it was just too much for them. Like, we were probably the worst place to go to with that kind of world. You know, we were really full of crime in that area, full of poverty,
uncultivated.
Yeah, you know, and
but it's the same idea. It's like a sort of outreach, you know. Yeah. Don't let the people that need you the most to come to you. Why don't you go to them and make it more accessible?
Yeah.
So do you know, like, with that Father Sheehy, without labouring the point, but how damaging are those? Or do you think he's preaching to a minority in this day and age?
I hope he's preaching to a minority in this day and age, but then I'm living in a bubble. Like, you know, I'm working for an organisation that's very open. Sexual health is our everyday. Yeah. It's great. I have a community of friends that are very open and very non-judgmental. So maybe it's easy for me to say, oh, maybe he is preaching to a minority. Yeah. Maybe in fact he's not.
Isn't that such a safe space that you just spoke about?
Yeah.
That bubble.
Yeah, it is.
Where people can really, really be themselves and they don't have to pretend to be somebody else.
Yeah.
You know, like, and the other side of it is whoever does believe in this priest and what he's saying, like, you nearly feel sorry for them, because they're living their lives in a different way.
Yeah.
Where their understanding of how to live and how certain people should live their lives is wrong. Yeah. You know?
It's a really judgmental space as well. Like, everyone's just trying to navigate the world and we're all just looking for happiness. Yeah. You know? And this person saying that, you know, that priest and condemning many of us, myself included as a gay man, like, it's a really challenging space to be at, where it was a very hatred-led speech for a group of people. Yeah.
And it's nothing got to do with Jesus.
No.
There's nothing to... Jesus doesn't
talk
talk about hatred for any groups.
Yeah. That's where I have a big problem when I hear people like this talking like that. Like, Jesus is our God is somebody that doesn't judge anybody.
Tolerance.
No matter colour or no matter what way you are, you're gay, you're straight, you're lesbian. God doesn't judge you in anything, but you have people like this priest who do judge, but it's not the way of God.
No.
You know, it's not the way of God, and it just does not make sense.
No.
You know, it doesn't make sense.
Do you know Robbie Lawler?
I do.
He was on the Tommy Tiernan show, and he spoke about HIV figures, HIV and AIDS, or HIV or AIDS, I can't remember. This now was about a year or two ago.
Yeah.
He was saying that they were bigger, the figures, the numbers were bigger now than they ever were in the height of the AIDS epidemic in Ireland. I thought that was eye-opening. What way is the HIV AIDS scene in Cork, or would you have any data?
Yeah, so as I said at the start, we started as Cork AIDS Alliance, and HIV work is still a crucial part of the work that we do. So we have a HIV counselling service, a HIV support service, and then one of our biggest services is our rapid HIV testing service. So for anyone who's living with or affected by HIV, they can contact us and we'll link them into counselling straight away.
Yeah.
And the numbers for that service have been growing over the last number of years, which is fantastic. People have found us and they're reaching out for support, and they're getting the support they need. For our rapid HIV testing service, it's great. So For now, you can get your result in relation to HIV in 1 minute. It's a finger prick test. And that's a service that's out on Dash as well, so it goes out to communities for people.
But you don't give the result on the spot, do you?
Give the result on the spot, yeah.
Really?
Yeah, so I suppose HIV has transformed as well throughout the years. Like when we think about when in the 80s when that epidemic started, people remember the ads and all the public health responses that were coming through. But the medication in relation to HIV is unbelievable today. So if you are HIV positive and you take treatment as prescribed, and the treatment is so good, it will get the virus in your blood to an undetectable level. What that means is that undetectable, you are unable to transmit that virus. So
pass it on.
You can't pass it on. You absolutely can't pass it on.
That's absolutely amazing.
It's amazing.
That must make people feel so much better on themselves, because there was such a stigma around HIV for many, many years, you know. And the reason I was kind of held back when you said you do the HIV testing on the spot and you give the result, I was saying,
so it used to be a couple of months.
That must be traumatizing for somebody. Like, would you have to have somebody on site to say, oh, it's okay, it's not as bad as you think it is?
Yeah, and all of our community testers are trained in, so they'll give all of that information to people, like the fact that if you have an undetectable viral load, you're untransmittable. So it's the U equals U message that's the campaign internationally. Yeah. And it's always important to link people to care. So the most important thing is actually having an updated HIV status. Each of us has HIV status, you know, and so all the time it's really important to update that after any new sexual partner on an ongoing basis, just to be sure, because with the medication being so good, the sooner you're linked to care, if you do have a HIV reactive result, it means the better your health outcomes and you live a long, healthy life. The bigger issue with HIV is the stigma that's still associated with it, thanks to the 80s. So in some ways, those public health campaigns had the most long-living impact of any campaign. You know, there's been how many health campaigns since, but people don't remember it as well as that.
Why are the numbers higher today than they were back then? What's going on, like?
So for a lot of people, I think that they're maybe not testing on a regular basis, so that's why the rapid HIV testing approach has been great. Or we try and go out to community groups, so we test in bars, we test in community organisations, we test in Dash, we test at our own organisation, Sexual Health Centre. You can just ring us and get a call. And
that's free.
And that's free of charge. And remember, it's not just HIV. So HIV, the numbers are increasing, but as are the figures for sexually transmitted infections. And often I think that's due to the fact that loads of these have no symptom. So, you know, you're not going to know. For most people, a lot of people, STIs are asymptomatic. So
What's the most renowned STI that's out there at the moment?
So
gonorrhea, I'd say, would it be?
Gonorrhea and chlamydia are always big ticket items, and there was a syphilis outbreak as well over the last couple of years. So
has monkeypox hit the Cork?
Yeah, so monkeypox has hit Ireland, and that's an ongoing epidemic that public health are monitoring now at the moment. And for a lot of people, you see, they don't perceive the risk, or I remember in college one of the big things they spoke about was this idea of unrealistic optimism, you know, where you think maybe you have had a risk, but it wouldn't happen to me, or it's not going to be me. It sure couldn't be. And
it has never been so easier to have casual sexual encounters with Tinder and Plenty of Fish and stuff like that. Like people can hook up, go and have sex, you know, but that could be, you know, like I know certain people that have many sexual partners. But if you think of the women they're meeting and they have many sexual partners, how many people are you actually mixing with on an annual basis? The risk goes through the roof.
Yeah.
And if you're not, I remember when I'm happily married a few years now, but when I first got with Gillian, before she would be intimate with me, I had to go to the Victoria Hospital, you know.
Oh, yes,
and I had to get checked.
Yeah.
A very mature thing for her to, you know.
Yeah.
So I did. No, it wasn't straightforward, to be honest. Well, it's sore, like they stick an earbud down through your Mickey, two of them. The second one really hurts. But then you get the all clear. I was delighted then, you know. But
and they're a lovely team. They're like
they make it as comfortable as it can be.
Yeah, and I think it's there every day. So
and it's discreet as well.
Really discreet. And when you go in, I think it's because it's there every day, they don't bat an eyelid. You know, for an awful lot of people going in, they might feel nervous about it, or they might feel like it's an intimate part of their of their life, and they're nervous to discuss it with somebody. But for that team, sure, they're at it all day, every day. So it's great, and it's never been simpler to get a screen now. So for all those people that are hooking up on a regular basis, what we'd say is after every new partner, just have a screen, just have an updated.
What does the screen involve?
So you can get a screen now via sh24.ie, so Sexual Health 24, and it's an online STI screening service from the HSE.
What do they send the pack out to you and
send the pack
and
out
you do it at home?
Yeah, so
Jesus.
white envelope arrives, totally blank. All the information's in there with a guide on what you have to do.
That's very important, actually, for people to know that.
There's no excuse.
Some people still have a bit of shame in relation to going into an STI clinic, you know.
And in fairness to the HSE, fair play to them, the Sexual Health and Crisis Pregnancy Programme have been leading it this nationally, and they've just made it a full national programme. So it started as a pilot. We were lucky in Cork, because Cork and Kerry were included in the pilot along with Dublin, and they've now expanded it nationwide. So it doesn't matter what your address is in Ireland, you can log on to sh24.ie and order a screen, and it'll arrive out in the post to you, post it back, and they'll ring you up with your results. So for many people, they would be nervous maybe about, or it might be location, like they might be living in a town that has a public STI screening service, so you don't need to anymore.
That's great. We did a corporate talk last week in Ringaskiddy in a pharmaceutical company called Hovion, and one of the drugs they manufacture is treatment for hepatitis C.
Oh, yeah.
Now, I remember years ago, a friend of mine had hepatitis C, and he was going through treatment interferon. And interferon, it was like a type of chemotherapy. He used to have to inject himself in the stomach every week. He was very sick, lost a lot of weight, skin colour looked terrible, very sick. When I was working in the homeless service here in Cork, many years later, I was bringing this guy out to the CUH. He was being treated for hepatitis C. He one tablet a day for 10 weeks. There was no side effects, and it cured him. Non-detectable. Amazing, the advances in medicine.
Oh, medicine's totally transformed. Yeah, it has. And like for HIV, and for many people, it's just one tablet a day as well, done. So they just think about their HIV in the morning, and that's it. The stigma is a much bigger issue that people are living with. So.
Can you tell us a little bit about the actual fears? Maybe some of the people that walk in your doors, like, and they have fear that they may have HIV. Like, how do yourself and the lads above in the sexual health centre approach somebody that comes in like that?
So if somebody's to ring us, we'll be able to talk through all the things I just spoke about there. So the options available to you. So the U equals U message, and the fact that HIV treatment has increased so much. I think it's always, for my team, it's always about meeting the person where they're at. So just being a human. Like,
exactly.
Everyone just wants to meet another human and not feel judged when they maybe have built this up for themselves. And people don't make a phone call to any service, actually. I don't think it's just sexual health, but to any service, without that build up at home first. So they're quite anxious by the time they've got on the phone.
They've probably thought about it for weeks or days even.
You can imagine how they're turning up to your door, and there's still the fear that they're probably feeling, and even the shame. You know, and they're walking in the door, and like the approach from yourselves is, and the body language and everything that goes with that is the most important thing that's going on in their lives. And I suppose if you meet it with a welcome and and make it like a normal thing.
And you have to realise, like, there's nothing that you haven't come across before.
No.
You've seen it all before. People recover, and there's treatment for everybody, no matter what they have.
Yeah, and even for people that have a non-reactive result, then we have lots of people that come through the door just for an updated HIV status, and they have a non-reactive result. But there's PrEP now, and there's PEP. So PrEP is pre-exposure prophylaxis. It's a tablet you can take every day as well. And even then, if you are exposed to the HIV virus, it will stop the HIV virus from contracting in your body. So you'll just avoid it altogether. Or you can take PEP, so post-exposure prophylaxis. If you fear that you might have been exposed to the virus, you can just go to your local STI clinic or A&E.
I have a vague memory of me and you doing a U equals U video for the sexual health centre.
You did. You were great.
You know, that took about 30 takes. It was only about 10 seconds long.
There was a blooper made now.
There was.
And you're just on time because the 1st of December is World AIDS Day. So we're launching our
100%.
Our park run, our World AIDS Day run, which we do every year with Ballincollig Park Run and Glen River Park Run. And we're going to Tremor Valley this year as well.
Let's make Timmy the face of AIDS in Cork.
It's into HIV stigma this year. So we're trying to...
But if you need a video, give us a show.
Yeah, we definitely will.
Tell us about what kind of aftercare you could get above in the sexual health centre if you have maybe if you're struggling around transgender, a gay man, just you're not kind of open to the idea of it, but how do you deal with people that are still in a little bit of denial and they need a little bit of help over the line?
Yeah, so we've 2 programs for that. One is our LGBTI support worker. So we were funded by the HSE a couple of years ago, thankfully, for this worker to join our team. I think, growing up in Ireland, sexual health is a hard thing, but when you are from the LGBTI community, there were no examples of what a healthy relationship looked like if you were in an LGBT relationship. And often, there wasn't as many role models as there is for our heterosexual counterparts. So the LGBTI support worker is there for people to have an open and honest conversation with and try and guide them through their journey. So it's not, that's specific for every individual. People come in with their own needs. It might be something around healthy relationships, maybe something with their journey about coming out. It may be something in relation to their sexual health and intimacy needs. Yeah. So people can struggle with that, or it may be queries that they have around sexually transmitted infections and how they can protect themselves, or how they can navigate protecting themselves within a new relationship or an existing relationship. So we do an awful lot of one-to-one work with that. We include LGBTI in all of our health promotion, so it doesn't matter where we are. There's a part of our workshop includes the LGBTI community and gender and sexual identity. And then we're also on a lot of those hookup apps. So we have professional accounts on those hookup apps, so people can reach out and ask us questions.
That's handy, actually.
We can signpost them to services, So that's one of our newest services, and it's a busy service. So we get about 10,000 queries a year via our helpline. We distribute around 40,000 condoms a year. People don't often say, "Oh, sexual health centre," and I know where you are, but plenty of people find us. So, when people are looking for us, we are there. And for loads of those things, online, isn't it, for many people, is where they're at most. So meeting them on dating apps, or making our services more readily available online, that they can order condoms and we'll just post them out to them, is so much simpler for them.
That's amazing.
Yeah, it's great service.
It's like it's like a different world completely to what I grew up in the 80s. We had there was no education around sexual education or anything like that. And when I speak to my own kids today, they're telling me that somebody's after been in the school today and they're after teaching about sexual education, and they have all the drawings on the board, on the camera or whatever it is, the television. And I talked to him about it, and there's no shame.
Yeah.
I could have never talked to anybody when I was young like that, because I didn't even know where to start. I was so confused.
Yeah.
Even around my own sexuality as a young person, I didn't understand it because it was never explained to me growing up. Single parent family, and school, there was no sexual education. And when I listen to my own children today, that's a big deal today, isn't it? For kids, they're actually starting to understand it. Do you think because of that, maybe kids today are having sex a little bit younger?
I don't know if they're having sex younger, but I definitely think it's important to give them the resources they need in order to make the choices that they want to make for themselves. So last year we launched Shift, which is our sexual health information for teens booklet, and like that, in what you're going through now, the booklet was made with young people. So we were interviewing them and had focus groups around what's coming up for you and what are your lives like, what do you need information about. And so there's everything from puberty to communication to new relationships to STIs to menstrual health, pregnancies, everything. consent is a huge part.
Yeah.
And communication cycles. And all of us have a love language, so people hear things differently. And you know, in communication, there's a sender and a receiver, isn't there? And so just because you send the communication one way doesn't mean that's exactly how it's received or perceived on the far side. And so being very clear on your communication and consent is crucial. That's a really important resource, because actually the most important thing is that you're knowledgeable and that you have all the tools at your disposal in order to make the choice that's right for you and the healthy choice for you moving forward.
Do you go into schools, or do you just have the literature for schools?
We just have the literature for schools, so we don't go into schools. I suppose over the years, RSE has transformed. So there was a point in time where the Sexual Health Centre did go into schools and did an awful lot of schools work. And then a number of years ago, the relationship sexuality education curriculum was overhauled and changed, and that's still ongoing. But teachers now are getting trained and are seen as kind of best placed. You know, they're with young people all the time. They're a trusted person in the young person's life. The young person can go back to them as well, time and time again, if they have any query. So we see ourselves as a kind of an addition to schools. You know, we have that shift resource that we will post out to schools. So we posted 6,000 of them at the start of this year across Cork City, so they're available to schools should they need them. And then if schools have any queries, we'll always contact them and say that they can signpost into us.
What could we be doing better? Or where what would you like to see more being done around sexual health in this country?
I think for things like SH24 have really transformed the area of sexual health in this country. So the fact that you can get a screen at home at any point in time is fantastic, and promoting that is a huge thing. I think in the area of HIV, really promoting the U equals U message around undetectable equals untransmittable, you know, that we're not stuck back in the 80s message, that we do know now that people on effective treatment cannot pass on the virus. And actually the stigma is all based in ourselves. So that's why we go out and do the run, to try and highlight what the myths were and what the facts are in relation to HIV today. I think in relation to, we've a crisis pregnancy support service, you know, that knowing that people can access a counsellor, and you know, a crisis pregnancy, any pregnancy can turn into a crisis. You know, if you lose your job, if your relationship changes, if it becomes stressful, if you've threatened to miscarriage, if there's anything that happens, that you can actually access that service is really important.
It's a great service.
It's a brilliant service. Yeah, really good service. And there's, I think, having the knowledge and being able to talk about sexual health with your friend groups, with your peers, and being able to know where you can find a service is really important. Like, we're really lucky in Cork. There's 10 agencies working broadly in the area of sexual health. If we're from the Gay Project in Link to Sexual Violence Centre, the Youth Health Service, a brilliant service over in Penrose Wharf, the South Infirmary, we've got public health departments, health promotion departments, SATU, the Sexual Assault Treatment Unit, ourselves in the HIV clinic. And together we've come together and launched mysexualhealth.ie, which is a one-stop shop for anyone living in Cork and Kerry. So every service is on there.
Everything.
Yeah.
That's
so
fantastic.
You'll have to link our podcasts.
Yeah.
So we've had yourself, Mary Cridley.
Oh yeah.
We've had a couple of survivors,
The
of
sex
people that
therapist
have
lady as well.
had the sex therapist. We had Georgina, who was sexually assaulted, and she gave her experience. So there's some relevant stuff there as well that we'd be happy to give you if you wanted them.
That'd be great.
Pleasure talking to you, Martin.
Pleasure talking
Yeah,
to you.
I really enjoyed it. Thank you so much, Martin. It's been very educational, not just for myself and James, but I'm sure for a lot of the people listening, and it might hit home for a lot of them as well. They might be going through some sort of issue, and they might get a lot from just listening to you and listening to us, and just maybe minimising what's going on in their head, and giving them pathways and opening doors for them to walk into your centre and
Pick up the phone.
that's it, and just get that courage to walk in there and talk about what's going on for you. You know, because we all know how an issue around ourselves or sexual kind of identity can really bother us, around shame and all these other things, and just talk about it, and it takes all that pain away, doesn't it?
Yeah.
That's it.
Let's talk about sex, Timmy.
You're starting up another boy band now here, James.
See you later. See you later, everybody.
Thanks, Martin.
God bless.
God bless, lads. Bye. Bye-bye.